Okay, so let's start with the basic question. Now, what are cerebral strokes and what causes them?
Before I start out on the questions, thank you very much for having me here. It feels wonderful to be part of this initiative, and thank you very much for the kind words, Rinjindi. As she mentioned, she is my sister-in-law, and that was a harrowing period for us when we lost Sanghamitra. So yes, I'm happy to be a part of this project. So yes, coming back to the question about what is a stroke? Now, stroke is, we are all somewhat familiar with heart attacks. So if we think in perspective of stroke, it's something like a brain attack. So what happens in a stroke is basically there is a sudden stoppage of blood circulation in a particular area of the brain, which can happen either because of a clot in a blood vessel inside that part of the brain, or it can happen because of a blood vessel suddenly bursting, leading to bleeding inside the brain. So these two mechanisms, they lead to stoppage of blood circulation in one particular area. And what happens after that is there is death of the brain cells in that area, and that is what we call as stroke. And as we know that our brain is a very, very specialized organ, and every cell has its own function. So when we lose our brain cells, we end up having functional loss, and which in certain cases leads to irreversible damage and even death. So that's what stroke is in clear terms. Yeah.
Now, basically, what causes these strokes, and what can what can be done in order to prevent them?
Right. So in general, if we look at risk factors for having strokes, the most common risk factors would be high blood pressure, diabetes, high cholesterol, smoking, obesity, and age. So these are the main risk factors for having strokes. In addition, there are certain other risk factors which are not so common. So when we talk about these risk factors and what we can do to prevent strokes, well, we need to treat these modifiable risk factors. So number one, high blood pressure. If someone has been diagnosed with it, to keep a tab on it, to monitor it regularly, to take medications that would take care of it. Of course, apart from medications, there are other things which I'm going to come to. So apart from that, taking care of your blood sugar, maintaining a good glycemic control. Again, cholesterols, there are various ways of dealing with it, not just medications. Smoking, of course, smoking is a risk factor for all sorts of health issues, and stroke is one major part of it. Obesity, maintaining a healthy body weight, keeping a tab on your waist circumference, maintaining a healthy weight. Apart from that, there are other risk factors like an irregular heart rhythm, which is also known as atrial fibrillation, which is more common in older people, but then can also be found in younger individuals. So if one is diagnosed with it, to be treating it. So these are the main risk factors for stroke. And when it comes to how to prevent or how to regulate these risk factors, apart from medications, there is something that comes before we start medications, and that would be our lifestyle in general. So to maintain a healthy diet, to maintain an active lifestyle, to have adequate amount of physical activity, to keep away from things that increase these risk factors like smoking, excess alcohol, to keep away from excess alcohol. So these are how, broadly speaking, we can take care, we can regulate these risk factors and overall lead to a reduction in stroke incidence. Yeah.
All right. You did say that it has a correlation with age. So
Yes.
what correlation with age does it have?
So now strokes, as most people would be thinking of, is, as Ranjini was saying, like strokes, everybody would be thinking, okay, so it's a disease of the older population, which is true to a large extent, because over the age of 55 years, it is, if we look at the larger spectrum of the disease, it is of course more common in older individuals. After the age of 55, with every decade, your risk of stroke doubles. So that is why it's more common as one grows older. But however, stroke is actually a disease that can affect any age group. We have seen strokes in children, and we've seen strokes in adolescents, young adults, midlife. And over the past couple of years, past decade or so, there has been a substantial increase in incidence of strokes in the younger population. And so now it is said that studies have shown that almost 10% of all strokes, they occur in the younger population, that is in between 18 to 50 years of age. So that is a concerning trend. There is a rising trend of stroke amongst the younger population as well, along with the usual at-risk population, that is the older group.
So, what could be the reason for the rising incidence of strokes in the younger population?
Right. So that is a very important topic. That is a topic of studies, a topic of debate, a topic of consideration at the moment, because the younger population, as we know, they form the backbone of any demography. They form the backbone of the community. So they are at the productive peak of their lives. So any disease, especially something like a stroke, which has long-term effects and can cause death as well, so and that can hamper the rest of the life of the individual. It's very, very important for us to see what is actually leading to these rise in incidence. So if you look at the risk factors for stroke, the modifiable risk factors like high blood pressure, high blood sugar, high cholesterol, so these risk factors are on the rise in the younger population. Now there are several factors behind it. It could be because of the kind of diet that is changing, like the kind of diet our previous generations used to take. It is obviously changing. We are in a faster generation, a faster life. People have less time, more stress. They do not have time for a healthy diet. They do not have time to think about what they're eating. People go for faster and quicker options, so that ends up in us taking more sodium, more saturated fats, more fried foods, more quicker options than healthier options. So that is one thing I feel. What we feel is diet could be one of the reasons. Again, physical activity, like especially in India, people are so busy with their work and commute. Traffic is so much, so people hardly get time for themselves. People with all responsibilities that they have, home, outside, careers, people do not get the time to go for walks or go for hikes or physical activity, or especially in that age group who are so busy with their work and family, they do not have time for physical activity. And many people, the office workers, the office goers, they end up in a kind of a sedentary lifestyle. They're in front of a screen for the rest of the day, for most of their day. So that's another one aspect. And apart from that, stress is an important factor, which is more common in the younger population because of all the pressures that they encounter. So it has been, studies have shown that stress, anxiety, depression, they are associated with a higher risk of cardiovascular events like strokes and heart disease. Because stress, anxiety, depression, and all, what this does is it can cause an increase in our heart rate, increase in blood pressure, increase in blood sugar, increased deposition of fats inside our blood vessels. So overall, it creates a very unhealthy environment inside the body. So that's the thing. So diet, physical inactivity, stress in general. Apart from that, people smoking. Of course, smoking is one of the major risk factors. Although people are becoming more and more aware, but whether that is translating into a less usage of tobacco, not sure. We have to look at further data. Apart from that, alcohol, people have a very fast life. They tend to have more incidence of increased alcohol. They're more exposed to all sorts of other substance use. A younger population, significant amount of younger population, they are exposed to substance abuse, all sorts of drugs, which can again increase one's risk for having these cerebrovascular diseases. These are the modifiable risk factors, which I would say. And then obesity. There's a rising trend for having an unhealthy weight because of all these background risk factors, which I already mentioned. So obesity is, again, it forms part of the metabolic syndrome, which creates an unhealthy environment within the body, leads to more fat deposition, more cholesterol deposition, overall insulin resistance, which will cause a tendency towards diabetes, less control of blood sugar. So obesity is another risk factor. So these are the modifiable risk factors. Apart from this, we have a large chunk called non-modifiable risk factors, which unfortunately we cannot really do much to as the name suggests. It's non-modifiable. Like genetic factors, family history, genetic tendency to have blood clotting inside the body. And then there are other factors, like in women, we have some non-modifiable risk factors. So these are all together, they are said to be causing an increasing trend of having strokes or heart diseases in the younger population.
All right. So the things that you said, they can happen with any of the genders, right? I mean, the modifiable plus the non-modifiable factors that you mentioned.
So now the
So
thing
what
is,
is so specific about women? Is there something different?
yes, absolutely. Men and women, there are just so many things different about the two genders. So if you put it in one line, we say, okay, these are the risk factors. So one person, a male and a female, they both have high blood pressure. Are they both at the same risk for having strokes? Well, actually, no. It has been found that women have these unique risk factors which are not present in men. So those are additional factors apart from the traditional risk factors that I already spoke about. So there are these unique risk factors in stroke, and also the usual risk factors which behave differently in men and women. So if I finish off from what I have already spoken about, in case of high blood pressure, high blood sugar, it has been found in studies that women tend to have strokes at a lower threshold of high blood pressure than men. Similarly, in case of diabetes also, studies have shown that women tend to have a higher risk for having strokes at a lower fasting blood glucose than men, which means at the same level of hypertension, same level of high blood pressure, the women would probably be at a slightly higher risk than men. So, and why these things happen, to be honest, nobody knows. The biological mechanisms are not yet completely known to us, and these are subjects of ongoing studies and everything. So that's one thing about the modifiable risk factors, which behave differently in men and women. Apart from that, we have several unique risk factors that are there in women, which men don't have to bother about. Like if we talk about pregnancy. So pregnancy itself is such a complex physiological change going on within the body that itself leads to certain factors that makes one prone to have strokes. So pregnancy in general, all sorts of strokes can happen. Pregnancy itself is said to be a condition, like a pregnant person is said to have 3 times more risk of having a stroke than a non-pregnant person of the same age. So that itself is there, one of the risk factors. Apart from that, there are several other things um, like high blood pressure during pregnancy. That's such an important risk factor, not just for having strokes during pregnancy or after pregnancy, but also risk of having strokes later on in life. So a person might have high blood pressure, hypertensive disorder of pregnancy in her 20s, and that puts her at a risk for having strokes later on in life. So that's another thing that's not there in men. Other than that, migraines, which can affect both men and women, but historically and evidence-based, it has been seen that migraine is something more common in women. And migraine with aura, that is complicated migraine. And along with that, if you put together like high blood pressure, and if someone is also smoking, so that itself is a risk factor for having strokes. So that is again something very typical for women. Apart from that, there are medications which women need to take, like birth control pills, hormone replacement therapy. Again, these also do not help much when it comes to prevention of stroke. Birth control pills, especially ones which contain estrogen, not all birth control pills. So these are the unique risk factors that work in women and at all age groups. Like younger people, you have birth control pills, you have pregnancy, migraine. In older ladies, you have menopause. So all these, again, they are like unique risk factors for women, in addition to the risk factors that work for both men and women, but just affect women a bit more badly than men.
Yeah, actually, my next question was, as it is going to be regarding the hormonal changes post pregnancy and all of that, but you already answered all of that. So, all right. I am kind of done with my list of questions. So, if the audience wants to ask certain questions, please go ahead. I think I did see somebody ask some questions. How common is stroke in persons with early onset hypothyroidism and late onset diabetes in persons above 60s?
Um, so hypothyroidism, it can cause certain hypothyroidism per se will not be considered as one of the risk factors for stroke, but hypothyroidism, untreated hypothyroidism can lead to other complications, like it can cause high blood pressure, high diastolic blood pressure. It's an endocrine disorder, and it's endocrine disorder like diabetes is also an endocrine disorder. So untreated hypothyroidism can lead to what we call as accelerated atherosclerosis, which means high cholesterol deposition within blood vessels. So that can be a risk factor for strokes. So blood pressure, cholesterol deposition, and also untreated hypothyroidism can to some extent cause what we call as insulin resistant, has some connection with diabetes as well, diabetes control. It won't per se lead to diabetes, but then it has something to do with the level of control. Apart from that, it makes one, if it is untreated, it makes one lethargic. It leads to increased body weight. It leads to less physical activity. So all of these together, they are not a very happy combination when it comes to prevention of strokes. So that's about hypothyroidism. The other thing was late onset diabetes. Now, I'm not very sure what you mean by late onset, but diabetes per se is a risk factor for stroke. The longer one has diabetes, of course, the more the risk towards the later periods of life. Because diabetes, especially if it is not well controlled, if it's untreated, not well controlled, it is of course a major risk for having a stroke. In fact, it has been seen that incident strokes or minor strokes which cause very subtle symptoms, or strokes which have just been detected on doing a routine brain scan, they're more common in people who have diabetes than those who are hypertensive.
All right. I hope that answers that. We'll move on to the next question. Next question is, what is TIA and how badly can it affect a woman?
Right. So that's very important for people to know what a TIA is. So TIA stands for transient ischemic attack. People sometimes refer to it as a mini stroke. Like here, when we talk to people in England, they call it a mini stroke. So that is what is a TIA. What basically it means is, transient means temporary or short duration. So there will be stroke-like symptoms that appear only for a short duration, usually never longer than 24 hours, and most commonly lasting for, say, a couple of minutes up to an hour, sometimes for a couple of hours. So basically, it's temporary, short lasting symptoms of stroke. That is what a TIA is. And why does it happen? It's because of a tiny blood clot that goes and blocks one of the blood vessels in the brain, and then it breaks down by itself, or in most reasons it breaks down by itself. The reason for the blockage, it disappears and function resumes. So the blockage in the blood circulation is not long enough to actually lead to permanent brain death or permanent brain damage, and that's why it's not a stroke and rather a short lasting temporary thing, and that's what TIA is. Now, the other thing is, why is it important to know whether someone has had a TIA? Because medically we treat a TIA in the same, you can say it is of the same importance as a stroke, because a TIA means that a person is at risk of having strokes. It was a mini stroke. If you call it a mini stroke, you would understand the importance of it. So if you have a mini stroke, it means one is at a risk for having a proper big stroke. And so we need to treat it in the correct manner to prevent further strokes.
Are there any symptoms of a stroke that are unique to women that exist?
To be honest, there are. Before I talk about unique symptoms in stroke, maybe it would be useful to just go through the usual symptoms that we have. So it's very easy to remember for people. I feel like every individual population, no matter of what age, should know the usual symptoms of stroke, so that they can actually access healthcare as soon as there's a suspicion for it, so that there's no delay in treatment and management. So we use an acronym called BFAST, BEFAST.
Yeah.
So which means B would stand for sudden balance problem, sudden unsteadiness. A fit and healthy person suddenly having unsteadiness, balance problem. E stands for eye problems, which means there can be a sudden loss of vision of one eye or both eyes, or maybe double vision, sudden double vision when you look towards the sides. So that's E. Then comes to fast. F stands for facial deviation or facial drooping, like suddenly the face will appear like that. Like a person is speaking, the face will appear to be drooping or deviated to one side. A stands for arm or leg weakness on one side. S stands for speech or language trouble, sudden speech, sudden slurring of speech, or sudden inability to bring out the words or understand, or just talking nonsense suddenly. And so this is BEFAS, and T basically stands for T stands for to call the emergency.
With Nivedita.
So that's basically be fast. So that applies to everybody, men, women, of all age groups, everybody. And the unique features in stroke, if you ask, though it's not very common, but we do studies have shown that features very vague symptoms like fatigue, feeling disorientated, sudden memory problems, headache, migraine like situations. So these seem to be more common in women, and sometimes they form like an aura, prelude to an actual stroke. So this is something that has been seen uniquely to women. But since these are not very common, these are useful for healthcare professionals. These are useful for us to keep in mind that, okay, so we should not be like shying away from, we should not be brushing these symptoms away and not take them seriously. It's important for us, but for everybody else to know, I would say everybody should be cognizant of the BFAST thing. So if any person who gets these symptoms, at the earliest, just call an ambulance, go to the hospital, try to reach as early as you can.
All right. Next question. On behalf of Nicola, living in London, I had a stroke 2.5 years ago. I still suffer severely from left side neuropathic pain, and it presents itself through tingling, pins, and needles, etc. I was prescribed gabapentin, which did not suit me. Do you have any natural suggestions?
Unfortunately, Nicola, there are no natural suggestions for it. It depends on which area of the brain was affected in the stroke. So in certain areas of the brain, like the thalamus or certain sensory pathways, when they're involved, they can cause this really nagging, tricky symptom, which is so hard to control with all sorts of medications. Some people respond to gabapentin, many don't. Then the other option would be to try out the other medications that are available, which are quite similar to gabapentin, but then some people do respond to the other things. Then there's physiotherapy, where there is like functional, sensory, feedback, all sorts of therapies that they do that does work in some individuals, but again, it can be quite resistant to deal with for certain people. To some extent, people would have to, unfortunately, they would have to learn to live with it to some extent, because there really is no way to completely get rid of it. There are other things like biofeedback. These are all therapies that people, physiotherapists and occupational therapists, they do. So unfortunately, there's no foolproof method by which we can completely get rid of this situation. It does get better to some extent with time, although it's already been 2.5 years, but still it does get little by little better with time, mainly because of neuroplasticity. That is, if someone, especially for younger individuals, what happens is the brain adapts itself. It creates new pathways, in which way the symptoms somewhat kind of gets a bit diluted to some extent. So that is a thing. Apart from that, taking care of other aspects like anxiety, general mental health, general calmness, all these things, they tend to take care of our pain pathways. They help us in pain modulation. Like people suggest these for chronic pain of any sort, like doing yoga, meditation, physical activity, anything that helps, anything that makes you happy. That also tends to kind of control our pain, that helps in pain modulation to some extent. So all these together, I would say, should be able to lead to some amount of benefit. But again, I'm afraid it may not 100% go away.
All right. Okay, moving to the next question. Risk of continuous use of oral contraceptives. Does that pose a serious threat in all women taking contraceptives, or only in those women with thrombophilia who are on the pills? Should they be taking pills at all?
Now, when we talk about oral contraceptive pills, there are various kinds of oral contraceptive pills. I'm not an expert on it, of course. I know effectively will give you much fairer idea of all the different kinds. But for us, what is important is the amount of estrogen available in the contraceptive pill. So that is why with time they have developed better, newer OCPs which have lesser and lesser amount of estrogen. And there are also progesterone only pills, which do not have any estrogen at all, which work just as fine. So it depends. So it actually depends on the amount of estrogen present in the oral contraceptive pill. These are the kind of OCPs that are found to be having increased risk of having blood clots and leading to strokes. So it has been shown that people on OCPs and with underlying background risk factors like high blood pressure, they tend to have double the risk of stroke as compared to women of the same age group without high blood pressure or not on OCPs. Again, if women are smoking while on OCP, that markedly increases the risk of having strokes. Then there are certain medications that can interact with the OCPs. They can bring the level of the OCPs up. OCP itself can cause other medications to work in a lesser effective manner. So that way there are some interaction which can again increase the risk. So that is there. And in women who have thrombophilia, so it is very important to screen these people and to see whether or not it's actually needed, how much is needed, if we can deal with only progesterone. So that is the thing. OCP itself, especially continuous intake, is definitely a risk. And that is why people who are to be started on OCP, they should have some background test done, especially high blood pressure. Screen for blood pressure before starting, screen for other risk factors like diabetes, cholesterol, all these things. So, yeah. Especially blood pressure, more than diabetes and cholesterol, I would say blood pressure, high blood pressure, smoking, thrombophilia. So these are major risk factors which will just compound the action of OCPs.
All right. So there is another question. Any correlation in between stroke and severe sleep apnea?
Right. So that's very important. I did not mention it in the risk factors when I was talking about it. So sleep apnea is a very, very important thing to consider, especially in the age group of, say, 30s, 40s, 50s. That's when it really creeps in. So what do we mean by sleep apnea? Basically, the person will be snoring at night. We find it to be a very innocuous thing, like, oh, that person snores all the time. But really, we need to look into it, like if that person is snoring, like is the person having sleep apnea, which means apnea means basically stoppage of breathing. So these people, what they have is they have these short phases of stoppage of breathing in between their sleep, and that can lead to mini breakages of sleep. And so how will it present? It will present as snoring, which will go on increasing loudness of snoring, and then suddenly the snoring will stop, and then there is complete quietness for a few seconds, and then again the snoring will start. So that's how it generally appears. And then that person will have daytime sleepiness because the sleep was so disturbed. The person does not know that he or she was waking up at night, because those breakages are really mini because of the breathing stoppage. But they will end up having daytime sleepiness. They'll tend to doze off, sleep off during the daytime. So these are the symptoms of sleep apnea, obstructive sleep apnea. Now, obstructive sleep apnea has been found to be a major risk factor that increases one's risk for high blood pressure, diabetes, high blood sugars, high cholesterol. So all sorts of metabolic adverse implications with regards to obstructive sleep apnea. And then again, OSA is found to be more common in individuals who have a higher, wider neck girth. So if someone who has central obesity, someone who has a shorter neck, wider neck, they traditionally it was described as a bigger collar size. So they are at more risk for having obstructive sleep apnea. So if someone has OSA, someone has too much of snoring, it's worthwhile to get it tested. And there are proper treatments for OSA which will majorly help in bringing down these risk factors.
Okay, I hope that helps. Moving ahead. I'm glad that we are getting so many questions. Okay. So, menopause, does it increase the risk of stroke?
Yes. So menopause, again, very important. It is an important risk factor in women, again, unique to women. So what happens in menopause is there are major hormonal changes going on. The estrogen level comes remarkably down to almost nothing. So that's what happens. Estrogen in our body acts as the natural estrogen within the body. It acts as a protective factor. So once the estrogen comes down, there is a risk for having all the metabolic factors like high blood pressure, diabetes, and high cholesterol. Falling estrogen also it puts one, menopause also puts one at risk for having increase in the body mass index, increasing weights, increasing waist size. So leads on to obesity. So that's another risk factor for stroke. Apart from that, menopause is associated with so many other psychological issues like depression, anxiety, stress, hot flushes. So again, they have been found to have some correlation with mini strokes, incident strokes. So overall, menopause is a major landmark milestone in a woman's life, and that is a time when there would be increase in these risk factors, and that kind of is a risk factor for stroke. And also studies have shown that early menopause, that is menopause before the age of 45 years, that has been shown to be a risk of stroke, leading to an increase in risk of stroke later on in life. And also shorter reproductive health, that is someone who's had an early menopause or has had surgical menopause because of gynec issues, they have had to get their ovaries removed. So surgical menopause, again, they are at a risk. They are at a higher risk as opposed to those who have later menopause. So menopause is definitely an important risk factor.
Correct. Okay. Next question we have is, so many young people between the age group of 40 to 60, men and women, are suddenly collapsing and dying. Is it due to sudden brain strokes or are they having heart attacks?
Well, hard to say what they are having because, but then mostly if you look at, you've seen celebrities just singing on stage and then suddenly collapsing, and on the way to the hospital, they die and they're brought dead to the hospital. We've seen this happening so many times. So mostly these circumstances are generally sudden cardiac death. Sudden cardiac death can be because of a massive heart attack. In certain cases, it can also be because of a massive intracerebral bleed. It can also happen. So it would really depend on what has happened to that individual, but mostly we call it a sudden cardiac death. If a person collapses right in front of us, that person would be said to be in cardiac arrest, and we would start immediate CPR. We would start cardiopulmonary resuscitation for that individual, keeping in mind that that person his heart has stopped. Now, why the heart has stopped? There are many reasons for it. I'm not going into that. It can be because of a heart attack. It can be because of a major stroke. It can be because of sudden air inside the lungs. There are many reasons for a sudden cardiac arrest. So most people that we see collapsing suddenly, it's a cardiac arrest.
Yeah. Next question is increasing rate of metabolism and aftermath of stroke causing it to deteriorate the health for a person over 50 years old male?
Not really sure what this question is. I'm not quite understanding the question. So increased metabolic rate. So decreasing metabolism is a risk for having strokes because it would lead to deposition of cholesterol and increased blood sugar and increased body weight. So and increase in deposition of all the unhealthy factors inside our brain. So that is decreasing metabolism that is seen in people over the age of 40s, 50s. As we grow older, the metabolism slows down. So decreasing metabolic rate is a risk factor for stroke. High metabolic rate is something that happens in certain disorders, like people who has an active say hypothyroidism, or somebody who has a severe illness like cancer, or so things like that leads to high metabolic rate. It leads to weight loss. It leads to loss of protein from the body, so muscle mass is lost, the person becomes very, very thin, the bone health goes down, the bones become brittle. So these are the consequences of abnormally high metabolic rate. So I'm talking about abnormally high metabolic rate. Normally we would like to have our metabolic rate at a higher level normally, by means of our physical activity and diet and leading an active lifestyle. So that is protective actually. So if someone is having an abnormally high metabolic rate, we need to look at the conditions that can lead to it. Now, the question was about high metabolic rate after a stroke.
Yeah, after stroke.
Yes, so I'm not sure what it really means medically, because I would have to delve deeper into what sort of symptoms that this person was having and what exactly the person was told actually to be having. Yeah.
Okay. We have another question, that is, my mother has Alzheimer's. She's 73. However, she's not diabetic or has no cholesterol problem or anything. She has always been very active. Is there anything which could have triggered it in her early age that led to Alzheimer's now?
Right. Right. So it's very pertinent. It's a very commonly, this is a question that we commonly encounter, like when we are talking about dementia. So dementia can be of several types. Alzheimer's, one of the most commonest type. Then there's another called vascular dementia. So vascular dementia is the one which is associated with high blood pressure, diabetes, cholesterol, the risk factors for stroke. Basically, they are also the risk factors for vascular dementia. Whereas on the other hand, Alzheimer is something that a person is just going to get if he or she is, like kind of destined to get it. There's no proper way, no foolproof way as yet known to us. There's no way to do neuroprotection to prevent us from getting Alzheimer's, because there are many genetic factors involved in it. Because Alzheimer's is basically because of an abnormal protein that develops inside the brain that gets deposited in the parts of our brain that affects memory and many domains of our cognitive aspect. So it's because of deposition of an abnormal protein inside the brain. Now, why this protein gets deposited abnormally, there have been studies for decades now, and there are many theories behind it. But most commonly, it has been seen that it has something to do with the tendency of the person to develop this. So there is a major risk which we can do nothing about. It's genetic. It's something that the person was just going to get. There's also family history. If somebody's mother or father has had Alzheimer's, there is a certain risk that person also may be to be at risk for it. There's something called, there are studies on it, but it has been considered to be one of the aspects, that is brain reserve. Now, if someone has a higher brain reserve, we would see symptoms of maybe a lower threshold, of a lower grade, as compared to someone who has a lower brain reserve. Which means by brain reserve, we mean that how mentally active that person generally was throughout the rest of their life. So that's something called brain reserve, for which we ask people to just engage themselves in mental activity, play, like do reading, do a lot of things outside your usual domain that may help you keep mentally active. But then all said and done, there are people, of course, who are so active, who are academicians, who end up having Alzheimer's. So there is actually no foolproof way to predict it or to even to prevent it. There are lots of studies with regards to genetics, to do some chromosomal tests, to look at specialized studies of the brain to see if that person is at risk for it. But then these are all in the research category at the moment. Unfortunately, medical science, as of now, we do not have great answers on how to prevent Alzheimer's. But of course, keeping in monitoring your vascular risk factors helps to some extent, because we see a large proportion of people who have a combination of both Alzheimer as well as vascular. So a combination, a mixed dementia is actually quite common. So that's all we can do. Just take care of our modifiable risk factors, be active, be mentally active, be physically active, and that's it. Rest of it is.
All right, thank you. Now that we are running out of time, I'll quickly combine certain questions so that we can answer it all together. So the next question is, Doc, when you observe Be Fast, what is the first aid kind of thing that you can employ at home before arriving at the hospital?
First thing is, when we talk of first aid means to somewhat mitigate the symptoms, so that you can prevent further damage. Now, in a stroke, in an evolving stroke, can you really do that? No, you can't. Just call for the ambulance. Just reach the hospital. So that's what you need to do. But if you see a patient, if you see a person is having seizures or having fits, in that case you can do some first aid, but please make sure that you call the ambulance. You ask somebody to call the ambulance, because that's the foremost thing that you need to do. There's no point, I would not suggest doing anything else, like giving a blood pressure medication or giving there's nothing you can do. So the only two things that you can do, if a person is having seizures, there are certain things that you can do. Make the person lie to their side, make sure that they don't injure themselves, remove all sorts of sharp or hard objects from around them, make sure they have space around them, don't try to pour water on them, don't try to put things inside their mouth, don't try to restrain them. So that's what you can do as first aid if a person is having seizure, which can happen in some types of stroke. Not very common, but still can happen. That's one thing. The other thing is, if a person is diabetic, it takes medications for sugar. Sometimes hypoglycemia, low sugar, can mimic symptoms of stroke. What you can do is, if you have a blood glucose monitor, you can check the sugar. If not, also you can try, if the person is able to speak, able to swallow, just try to put in a spoonful of glucose or sugar and see if they're getting better. But at the same time, make sure that you call the ambulance, because I would not want anybody to be wasting time trying to do some things at home when the person is actually having a stroke. Because stroke is actually a time-sensitive disease. The treatment actually depends on the time. So if you reach hospital within 3 hours, and for certain population, 4.5 hours of starting the stroke, then there are certain things that we can do that can massively improve the outcome.
Agreed. Okay. Where did it go? Yeah. So the next questions, I'll just combine them. One person is asking any suggestions for people with severe migraine, and the other question is risk of cerebral stroke in cancer survivors. Also, any advice? So you can combine your answer.
Right. So migraine is basically, as I said, migraine is a small risk factor. It has been seen that migraine might be leading to having, there's a slightly higher risk of strokes in people with migraine. But if people with migraine have additional risk factors like high blood pressure or if they're smoking, then that's a big risk factor. So that's the thing. Check your blood pressure, make sure it's all right. If you're having severe migraine, get it treated. You can take prophylactic medications, see if you can get rid of some of the triggers. So overall the frequency comes down and you feel better. So that's about migraine. Also, if a person with migraine is also taking OCPs at the same time, oral contraceptive pills, again, that's like an additional risk factor. So any other risk factor combined with migraine leads to a higher risk. So that's about migraine. The other thing about cancer survivor, per se, some types of cancer, they lead to higher risk of having blood clots inside the body, especially cancers inside the stomach, some cancers inside the lung. So these are some of the cancers that that lead to a slightly higher risk of having strokes or blood clots in any part of the brain of the body. It can be inside the veins, it can be inside the arteries of the brain, it can be inside the heart. So some cancers are associated with an increased risk. Apart from this, I would say just the usual what we do for other people. Just take care of your other risk factors. So nothing additional that needs to be done. So if your oncologist feels that you need to be on some sort of blood thinner medication to prevent blood clots, or if someone has had a blood clot while having been diagnosed a cancer, so that person would probably be placed on blood thinner medications to be continued for a long duration. So.
All right. So there's one last question. Are there any screenings, preventive measures available to predict or prevent strokes?
Yes, so screenings would be overall maintain a healthy lifestyle, be aware of the symptoms of stroke so that you can help yourself, help others around you. Blood pressure, if someone has risk factors like family history of early onset high blood pressure, diabetes, strokes or heart disease, then get your blood pressure checked. Even if you're in your 20s, just get it checked once. At least if someone has a high body weight, if you feel that you're obese, you have a very high body mass index, then get your blood pressure checked, get your fasting blood sugar done at least once, cholesterol's done at least once. If everything is fine, just do some active measures to take care of your overall metabolic health. Once we get older, like once our stress also increases, 30s, 40s, once you're more than 40, at least get your blood pressure checked once, get your fasting blood sugar checked at least once, and if normal, then every 3 years at least you keep check on it. So this is what I would say. Once you get older, make the frequency shorter, do more checks on these. And if at all diagnosed with high blood pressure or diabetes or any of the risk factors, make sure you're treating it well, make sure you're controlling it, just not relying on medications. Do something from your own self, like, as I mentioned, healthy diet, healthy active lifestyle, avoid smoking, avoid secondhand smoking. Passive smoking is also as bad as actual smoking. So yeah, these are the things that we can do.
Okay. Thank you so much, Dr. Chetana, for, coming here and sharing your knowledge and being so bright with all your answers and being very, very, elaborate at the same time, very pertinent with your answers. So it was wonderful having you here. And we would also like to have some of your remarks before we move on to the vote of thanks.
Right. Thank you. I thoroughly enjoyed today's session, and I hope that it would help some people at least to actually to know about the basic symptoms of stroke and how it is not just a disease of the elderly, and how it can affect any individual, and just to be aware of our own health, to take care of ourselves, not just go after our, get carried away with all our other things like careers and family life, and have no time for ourselves. Because we were talking about women today, and it's very important fact. It's been shown globally. It's not just in India. It's been shown in US, UK, everywhere. It was a topic of discussion in the House of Parliaments in the UK, that healthcare access in terms of women is actually, there's so much of disparity between men and women. Women tend to go to hospitals less. They tend to brush off their symptoms saying, oh, that was nothing, that was just probably nothing. They are so much more concerned about what's going on with their children and their husbands and parents and career, that they completely forget about their own health. So just go to go to the hospital if you have symptoms. Take care of yourself, find time for yourselves. Don't get carried away by your everyday stress, and just make sure that you are healthy before you, have your oxygen mask first before you give it to the others. So
yeah,